Today I want to talk to you about heart disease. The reason is because it's so important. So many people are at risk for it, even those without the classic risk factors like high blood pressure and high cholesterol, smoking, diabetes, a family history of early onset heart disease. The fact is that there's one variable that affects all of us and therefore puts our arteries and our hearts at risk. And that factor is stress. The way our body handles stress is to circulate adrenaline from our adrenal glands to course through the blood and to change how our heart flows. And the reason was because in the days of living on the plains where there were lions, we could be chased. And to survive, we would have to run faster than usual. And our body had this great adaptation, which was to help us run faster by diverting blood away from non-essential organs like the liver and the kidney and even the brain at the time of that emergency so that we could run. But in our modern world, the 21st century, our body has not caught up to our brain. The fact is that we can imagine and experience many stressful conditions and thoughts that have nothing to do with mortal threat, but still send the same adrenaline coursing through our veins. The chronic symptoms then of this impact of high blood pressure, faster heart rate, and other circulating molecules put stress and strain on the inside of arterial walls. Combined then with other molecules of inflammation, fat, calcium, those walls get damaged, our blood gets thicker in some ways as a result of some of those same phenomena, and then with an acute stress like lifting something heavy or screaming at our boss or a nagging spouse, the wall cracks and a clot occurs inside a small artery in the heart, and the blood that's supplying heart muscle beyond it doesn't supply the right amount of oxygen, and that heart muscle suffers a cramp, and if it lasts long enough, that causes permanent, irreversible damage to that heart tissue. The reason it's fatal in a third of people is when the heart tissue is damaged that way, rhythm abnormalities can occur. And even if the territory is not that great, meaning the amount of heart muscle is not that great, a rhythm disturbance at the wrong time leads a lot of people into a state of extremis, meaning death, and their first symptom of a heart condition is a fatal one. Nobody wants that. But understanding how the risk factors combine, particularly the stress, allows us to focus on a way of dealing with heart disease that I think goes beyond the conventional. The conventional typically is, if you wind up in the emergency room with such a syndrome, they give you aspirin and something to dissolve the clot. There's invasive treatments like putting a balloon in an artery and expanding it, or bypassing the artery altogether with open heart surgery. Those can save lives, and they're very important. For people who have symptoms but not something as extreme as a heart attack, people are given medications to lower their blood lipids and their blood pressure. They're told to live a different way. And many people are told to live with attention to the detail of how much stress they're exposed to. But I don't know that conventionally we're getting great advice. So that's what I want to do right now, which is I want to talk to you about the slow medicine approach to heart disease, which goes beyond the conventional and allows one to live and to generate a way of dealing with stress, to maybe live a low stress life, to reduce the amount of inflammation that occurs, coupling with those other risk factors so that it's less likely to lead you into a situation where you have the experience of a fatal heart attack, but even short of that, just suffering from the chronic syndrome, the anxiety associated with it, the limitations that it can impose in your life. The idea of the slow medicine approach is to consider the opposite of the sympathetic nervous system's fight or flight, which is the parasympathetic's rest and digest mode. Prototypically, it's stimulated when you take a deep breath and you stimulate the vagus nerve, which is in the diaphragms beneath the lungs, and that slows the heart rate. It re-establishes flow of blood to organs like the liver and the kidney, the brain, and the digestive tract. It allows you to rest, digest. It's good for your immune system. And ultimately, it stops the cascade of those circulating hormones, which puts stress and strain on the inside of your arteries that hardens them, that ages them, and makes them prone to that ultimate experience, the fatal crack, and ultimately all the experiences that you don't want. The method of slow medicine is to consider how one then touches and pushes that parasympathetic button. And there are several ways of doing it. In my book, Slow Medicine, Hope and Healing for Chronic Illness, I talk about the slow medicine wheel of health, which has 7 spokes. They include the physical body, our mental emotional state, our relationships to each other, to the natural world, to the divine, our communities, and our life's purpose. And for me, the idea is to feed your heart with things that nourish it. The meaningful work, the meaningful relationships, the attention to the detail of wholesome food that's not only good for your body but serves your community by supporting local agriculture. While everyone can't do all those things all the time, we could multitask. We can do more of those at the same time. For instance, we could garden, in which case we're out and moving and hands in the dirt with other people, creatively sort of putting things together so that months after we plant some seeds, we actually eat those vegetables. We can dine with other people sitting around us. We can turn off the technology. We can connect. We can light candles. We can say prayers. All those things connect the dots between the different parts of our physical, emotional, and spiritual anatomy and allow us then to push the parasympathetic nervous system to get ourselves out of stress and to get us into a state of balance, which is not only preventative for heart disease, but for many other conditions. The 3 steps that I'd like you to think of doing right now, as I mentioned, feed your hungry heart. In this regard, you can even consider things like music and art, animals, nature, travel. You can nurture your body-mind. You could think again about where your nourishment comes from, the literal food, but also the information that you pay attention to, what you read, what you watch, who you speak to, the context and the content of your conversations. Are they in harmony and balance and peaceful? Or are they aggravated and antagonistic? You have a choice. I'm not telling you to turn off everything. I'm just telling you to think about how you can shift the balance, to shift some of your activities so that you're living with enough time devoted to the parasympathetic, calm and easy way of living. Ultimately, you want to avoid your heart attack so that you can continue to thrive in your relationships with other people. The third of the 3 suggestions that I make is to nurture those relationships, the good ones, the harmonious ones. Spend more time with people who you really love and who love you and who treat you with respect and kindness. You may not be able to leave your job and slam the door in front of your boss again and do it this way, but you can find more time with the people who do support you. And eventually, as you grow in strength and harmony and clarity, you might be able to make decisions, such as moving toward your life's purpose and passion, away from environments and conditions that stifle you. You may feel stronger and able to do that. But the first steps are 3. Again, to feed your hungry heart, to nurture your body, mind, and to nurture your relationships. And you can get help. You can find other people in your community who support those same activities and do them together. You can dial into the upcoming Doctor is In seminar that I'm going to lead on February 22nd at 5:30 p.m. Eastern Time for a free 30-minute consultation. Call-in number is 641-715-3580 and the access code is 949875. You can arrange a consultation with me at any time, either live, in person, on the phone, or Skype. I work with my life partner, Robin Queen Finkelstein, who's the slow medicine therapist. Together we do a 12-week program called the Slow Medicine Immersion that you can join, and we can help you over time carefully weave together this program. My book, The Slow Medicine, Hope and Healing for Chronic Illness, essentially is a do-it-yourself tool, and that's always available. And for more information, you can go to slowmedicine.org or call us anytime, 914-218-3113. I look forward to speaking to you and helping you. In the interim, take care of your heart, and it'll take care of you.